Thank you.
Do you see something that looks like the official Co-Design Hub website? Yes, okay. So I'm going to get us started. This is our website. Again, as Emma said, we post the speaker series. If you miss one, they're usually posted there. You can have a look at the website. Please feel free to tweet or email us, and we have a mailing list as well. If you're not on that, you're welcome to join, and then you'll be updated as to what's happening. So I am going to actually start with the land acknowledgement, which becomes particularly, I think, poignant given the events of the last month or so. And so really want to begin by acknowledging that McMaster is on the traditional territories of the Mississauga and Haudenosaunee nations, and within the lands protected by the Dish with One Spoon Wampum Agreement. And I've got the picture here to honor the many Indigenous children who have suffered in residential schools, including the remains of the 215 who are found in the grounds of the Kamloops residential schools. So really thinking about that and the history of colonialism, and really thinking about reconciliation and how do we transform our personal and institutional relationships with our Indigenous friends and neighbors. So just a moment. So I also have the pleasure of introducing our speakers today. This is the last, but definitely not least, of our speaker series before the summer break. And I am quite excited. I've heard some of the work happening at Emboldened and some of the innovative work that you're doing. So today's a chance to hear a little bit about development, implementation, and evaluation of their community co-design process to support older adults' mobility. And I don't have a picture of Penelope here, but I will introduce her as well. So Dr. Rebecca Ganon, is a registered nurse and assistant professor in the School of Nursing at McMaster. She's the co-scientific director of the Aging, Community and Health Research Unit. And through her work through the Ontario SPORE Support Unit and the MIRA Collaborative for Health and Aging, Dr. Ganon works to advance the science of patient engagement. And her research program is focused on older adult engagement in co-designing community-based health research to promote health, mobility, and well-being in older adults and address health inequities. She co-leads an interdisciplinary study called Emboldened, which is funded through the McMaster Institute for Research on Aging's LaBarge Center for Mobility and Aging. So welcome, Rebecca. Maggie McNeil is a postdoctoral fellow in the Department of Health Research Methods, Evidence and Impact at McMaster University. Her research interests include health policy, gerontology, health technology adoption, and evaluation of older adult engagement in research. Between 2013 and 2015, Maggie was a policy analyst in the Minister of State for Seniors Support Unit, Employment and Social Development Canada. Her postdoctoral fellowship is focused on evaluating a community co-design initiative with older people and community health and social service providers. And then her picture's not here, but maybe Penelope, you could wave to us. Penelope Petrie joined the Emboldened team in 2019. She's a retired teacher and lifelong learner. Penelope is a volunteer with a number of organizations in Hamilton and McMaster University that focus on issues impacting older adults. She had joined the Emboldened study for the opportunity to have input into a project that has the potential to improve the health and lives of older adults in Hamilton and beyond. Penelope's goal is to ensure best practices are being implemented in communities in need. So welcome to the three of you, and I will stop sharing my screen and turn the floor over to you.
Do I see the right screen? You don't see presenter view?
No, we see the right screen. Thanks so much, Maggie.
Yeah.
Okay, so thanks for that, that kind introduction, Sandra. We're really excited to be here today. Maggie and Penelope and I have been working closely on this project with a number of others that are involved in our team. It's really been a joy to work together. So we're excited to share a little bit about what we've been doing today. So Today, the things that we're going to be sharing with you, you will learn about our community co-design process that engages a large academic research team, a number of health and social service providers, and a pretty significant group of older adults who are coming together collectively to develop a new way or a new intervention to promote mobility in older adults and promote their health more broadly, including physical activity, socialization, healthy eating, and system navigation support. So helping people to connect with the health and social services that align with what their needs are. And we'll also be talking a little bit about some of the challenges, but also the opportunities that have emerged related to responding to co-designing during a pandemic. And we also really want to highlight for you some of the contributions, the important contributions and incredibly valuable contributions that our research partners have made to the design of our study. And then we'll sort of wrap up by talking about the evaluation. So we're going to give you a little bit of a talk about some of the things, the early contributions that our partners have made, and then Maggie's going to talk about how we're evaluating it more formally. So I just want to start with a little bit of background and context. So what we know about, so this is a program of research that's situated in Hamilton. We're now looking at expanding to other communities, but looking in Hamilton, we know that there are quite a number of community-based programs that exist to support older adults in terms of their physical health and their community mobility. But for the most part, they're a bit underutilized, in particular when we think about engaging people who are facing health inequities. So, as we were learning and developing this proposal, even from inception, we were hearing about sort of these usual players or usual people that come out regularly to programs, but that the people that are involved in the programs really don't reflect the broader community of older adults in Hamilton. So that was an important issue to start to address. And the other part that we know is there's a lot of great research around how some of these community-based programs or group programs to promote physical activity, for example, there's lots of great research, but a lot of it hasn't been conducted in real world settings. So it's sort of been in lab or ideal settings, and they have either not been translated into real world settings, or it's been done with quite a lot of difficulty. So, and what we know in terms of opportunities is that citizen engagement in health service design and delivery can lead to improvements in health outcomes, care, quality, safety, and it can actually make some of the services and supports more cost efficient. And so we're setting out to address some of those gaps through this citizen engagement process to look at a novel way or a new way of delivering supports to older adults that tackle some of these challenges or barriers. So we hope that it'll be implementable, so it'll be feasible, it'll be acceptable, it'll be appropriate, it'll be effective, and we really think that our co-design process is going to help to achieve that. So just I know we've got a really sort of variable audience in terms of the spaces that people are working or researching in or living in. And so I just want to start by talking about how we're defining mobility. So when we're talking about mobility, we're talking about the ability to move oneself within community environments that expand from someone's room to home to outdoors to their neighborhood and their surrounding area and the world more broadly. Certainly in the context of COVID, that has changed for all of us, and in particular for older adults. It's shifting now as we're moving forward with people getting second doses and more protection from COVID. But this life space approach to mobility has really dramatically changed for everyone in the past 15 months. Or so. I guess we're going on longer than that now. Oh goodness. Anyhow, so next slide, please. So the other thing that we know, this is quite a large research program, and it was really important from the outset for us to have a transdisciplinary approach so that we were working with common language, we were coming together, we were drawing on, within our academic research team, drawing on a variety of disciplines. So our research team has expertise in nursing, in citizen engagement, in public health, in knowledge translation, kinesiology, rehabilitation sciences, geography and earth sciences. So we've got this really large and other health science disciplines, got this really large interdisciplinary academic team. And then I'll have you go to the next slide, Maggie, please. We actually have this really rich team that, as I suggested before, has quite a number of organizational partners within the city of Hamilton and Hamilton-Halton. But also we have some rich, diverse perspectives in terms of our older adult partners. So it's really the expertise within this team, and I feel like we've really achieved this partnership model where we're really working together and sharing ideas together and respecting diverse expertises and looking at what each person can bring to the table to be able to engage in this process. So I know, again, many of you may be working in a co-design space or maybe doing different co-design processes. In terms of how we're framing co-design for this particular project, we're thinking about it with the lens of bringing consumers, carers, families, and health workers together as partners to improve health services. So we're borrowing this definition from Australia, from the New South Wales Agency for Clinical Innovation. However, it really does have a little bit more of a clinical orientation. So some differences in language here. And we're not just thinking about health workers, we're also thinking about health and social services. So thinking about integrated ways of delivering supports or services. But overarching, the goal is to partner in research to ensure that it's in alignment with the existing community context, the needs and experiences of the population. Like that's really central to what we're doing. So our goals are to explore the priority features of a community-based group intervention to promote physical and community mobility, and to co-design an evidence-informed and contextually relevant intervention to support mobility and promote health. And so this is, as I said, it's a large multi-year study. And so we are currently in phase 1 of this study. So we've completed some of our foundational projects. So one of our first steps was conducting an environmental scan. We have also been looking at the best available research evidence. And then we've also done, in partnership with those 2 foundational studies, we've done a qualitative co-design study to identify some of the interventions features. And this is separate from our guiding council. So we have this qualitative study, and our strategic guiding council has been intensively working with us during this co-design phase, but they will continue to work with us as we move forward with first a pilot site, so implementing in a pilot site, and then rolling out into a larger trial. And thinking ahead, although phase 3 is sustainability and scalability, we're really starting with thinking about sustainability and scalability right from the outset to make sure that what we're conducting, and when you see what we're talking about with pragmatic randomized controlled trial, if that's a term that people aren't familiar with, that's what that's getting at, is that it is conducted in real world conditions, trying to use the usual people who might be delivering services, so leveraging some of the existing services, looking at broad inclusion criteria. So, sometimes randomized controlled trials can have really tight inclusion criteria or exclusion criteria where, and sometimes what happens in particular amongst older adults is they may be excluded based on various health conditions. And we really have tried to intentionally keep that broad. So all of this ultimately leads to this goal of sustainability and scalability. Next slide, please. So as I said, the core program features include physical activity, healthy eating, social participation, and system navigation. So these are the core components. And then from there, we've identified specific intervention features that align with each of those components. So the framework that we're using for our co-design is the Collaborative Intervention Planning Framework. And it really has 4 key steps: setting the stage and building a foundation for collaboration. And we're going to talk a little bit about what some of those foundational steps were and some of the mechanisms that we used to support that foundation for collaboration. It also, at the outset, involves some problem analysis and assessment. It had us looking at reviewing intervention objectives and the theoretical foundation and developing an adapted intervention. And you might sort of look at that and think, well, wait a minute, didn't you say you're co-designing an intervention? But if you remember a couple of slides ago, I talked about having it being evidence-informed and contextually relevant. So although we are co-designing the intervention, we are starting with what does the best available research evidence tell us? And I'm going to talk about that in a couple of minutes. And taking those ideas bringing that together with what we know about what already exists. We don't want to duplicate what's already working well in the community. We want to make sure that we're filling gaps and think about, well, then how do we design this in a way? And we're taking that the qualitative study as well, and our conversations with the guiding council, and all of those together inform our decision-making about this adapted intervention. So some of the mechanisms we've used to engage, at the very outset, we had a community launch event. And then after that community launch event, we moved forward with assembling a strategic guiding council to bring together those perspectives. And some people, for the most part, people were really engaged after the launch event. And many people said, yes, we're committed. We'd like to keep moving forward and partnering with you around that. Some said, this is great, but we think actually someone in my organization might be better suited for this ongoing relationship, and they are doing that. And ultimately, when we move forward with the trial and implementing in different sites, we will also have local neighborhood community advisory boards that will help to inform the on the ground adaptations that may be site specific. And then at the end of the study, we plan to have deliberative dialogues to tie together the findings of the trial and look at what the implications are in terms of sustainability and scalability, and come up with some recommendations for moving forward. So the role of our strategic guiding council, they play multiple roles in this study. Most importantly, guiding the co-design, testing, and future planning of the program. Our guiding council provides guidance on all research directions. So and in fact, we're just preparing, we have an upcoming meeting, and we're planning to come back to the guiding council and really share with them all of the decisions that they've informed, all of the things that we've heard. And that's an important thing in co-design research, I think, is really making sure that we're closing the loop and ensuring that people understand or can identify the ways that the research has been impacted because of their input. They're really helping us to identify where there are opportunities, what are some of the limitations of some of the, as we're thinking about some of the decisions, what are some of the limitations associated with some of those decisions. As we're moving forward as well, our partners will help us to guide how the study findings are shared. And Penelope is here co-presenting with us today. She presented again recently with us related to some other work. But at the end of the study, we also anticipate, or we're hoping that our guiding council will help us to co-present at local or provincial forums that we plan to host. So the environmental scan project was really important for us to start to identify within the city of Hamilton, where were their priority neighborhoods. So we started by looking at census data and looked at identifying neighborhoods based on community level health inequities. So it's not that an individual living within that community necessarily has to self-disclose that they are facing particular health inequities. What we started doing was looking at a neighborhood level and thinking about the importance of community influences on health. So we looked for neighborhoods that had 1% or more older adults living there. They had 2% or more living below the low income cutoff. So when we were looking at older adults, the percentage that were living below the low income cutoff, we also looked at material deprivation scores, where there were neighborhoods where it was more common for people to have difficulties meeting their basic needs. And we also, our fourth criterion was related to looking at where there were high percentages of immigrants. Now, that's not a perfect measure or a perfect way of looking at it, because it's not an intervention that's explicitly looking at immigrants. However, we do know that we sort of looked at that as a proxy measure in thinking about where people might face linguistic or cultural challenges in terms of they may experience barriers to connecting with services and supports. And we know that from our conversations with the guiding council, our early conversations, that those were populations that perhaps weren't being well engaged in some of the available supports. We also looked, once we'd identified those neighborhoods, we did windshield surveys in those neighborhoods to explore what assets and gaps were available in existing services. And we created some co-design tools, or some tools to support our co-design discussion, so that we were all operating from a common sort of place of understanding about these neighborhoods. So and that's just on the next slide, if you don't mind going to it, Maggie. So this is an example of what we did. For each of the neighborhoods we identified, we put together the census data and started to identify population, sort of highlights of the population and where there were, for example, it was helping people to easily see where people were spending a high amount of money on their cost of living, their cost of housing compared to what their income was, seeing where the average income was after tax, and it was dramatically lower in some of these neighborhoods. Looking at the age distribution, some of these features were really important and I think helped us to say, what does this neighborhood look like compared to the city or head to head compared to another neighborhood? So our next foundational study was looking at an evidence review. And I'll tell you, it started as one review to begin with. So we first looked at the best evidence. We searched the evidence to see what we could find in the literature in terms of group-based physical activity and nutrition interventions. And we found a lot of literature. And so when we were going through that process, we realized there were actually a lot of systematic reviews. So there were quite a number of reviews where the research had already been synthesized and brought together. And so we decided we didn't need to go into the individual single studies. We could keep it at the level where the studies had already been synthesized together. However, when we did that, then we realized that there actually weren't any interventions or any systematic reviews focused on healthy eating interventions alone. So there were sort of a small number of reviews that included physical activity interventions plus supplements, but there were no synthesized studies that looked at sort of group-based, broader healthy eating interventions. And so from there, and when we shifted in terms of COVID and we had a bit of a pause, then we shifted over to conducting a review of single studies of group-based healthy eating interventions, and we found 31 of those. And then we also, when we were looking at the system navigation component, when we were designing this study, there was a review that had been done and we made the decision to update it because it had been a few years since it was done. And it also was a scoping review rather than a study looking at what the impact of those system navigation interventions were. And so we're currently completing that system navigation review. So it's been busy, as you can tell. And so from there, we conducted those reviews. And the first review, because we started there, has now been completed, but we partnered with some members of our guiding council to then take the results of this lengthy systematic review and quite complex review and say, okay, how do we make this in an accessible format that, again, everyone can be on the same page and have a common understanding of what we know about what works. Which interventions are most effective? What are the interventions out there where there's evidence? What is the impact of those interventions? And which were the most promising in terms of impacts on these outcomes that we were interested in around heart health, daily function, balance, falls prevention, and muscle strength. So our guiding councils helped us to design this knowledge translation tool, or this infographic is another way of calling it. So together, the environmental scan and the review findings provide this foundation for co-designing this intervention that targets those components. So we anticipate that the co-design process will integrate local and research evidence, that will explore lived experiences and emotional touch points, which is really characteristic of experience-based co-design, identify strategies to address unmet needs of older adults. The process will help us develop a feasible and acceptable community-based intervention to improve physical and community mobility. The co-design process has already helped us to identify the pilot neighborhood in which to test the intervention and will guide implementation and scale up. Oh, sorry for the duplication. Let's just move to the next slide. So I wanted to give you a sense of our community launch event because this was really important for us to start to bring everyone together. Prior to that, other than when we were developing the grant, we hadn't started to bring all of the partners together. And so we brought, you can see on the walls a little bit in the back, these were maps that we constructed from our windshield surveys, and we had a variety of tools and resources and had really interactive discussions to start to make sense of what was important. First of all, how would we work together? And secondly, how do we start to visualize what this intervention might look like? And so I talked earlier just briefly about the co-design qualitative study that we're doing. And so our approach to conducting this study was using persona scenario exercises. And initially, when we were conducting this study in person, people were creating these persona scenarios in pairs. And so what persona scenarios are, if someone isn't familiar with this, is coming up with a true to life sort of main character in a story and their scenario or their story about how they might engage with the intervention, which is what we were designing. And we had two different groups of participants who were doing this. We had older adult citizens and we had health and social service providers, each looking with their own lens on how they might engage with the intervention, either as a participant, as someone supporting someone who might benefit from the intervention, or someone who might either refer to or deliver the intervention. So there were a variety of lenses that people brought through in these personas and scenarios. And then from those data, the qualitative data, then we started to look at what the emotional touch points were as well, looking at where people's experiences were, some of the things that worked really well, but also some of their negative experiences and things that we wanted to avoid. So the things that worked well, we were hoping to replicate. The things that were sort of negative, had negative touch points, we wanted to try to avoid or address. Some of the things that we've identified from the persona scenario interviews was that it was really important, as we have these four sort of components of the intervention, we heard really quite clearly that people didn't want it to be sort of a component one day, talk about nutrition one day, talk about physical activity another day, talk about, social opportunities another day, that it was really important to have this sort of threaded curriculum, or what we're calling a threaded curriculum, where each of those elements were included each day. It helped us to identify the number of sessions. So initially we'd sort of built in, we could envision up to a 6-month intervention. We heard that it should be shorter, that 12 to 15 weeks was sort of ideal, but more intensively than we'd initially thought. So we thought maybe it would be a monthly, and people thought no, a weekly would be good. And so that's where we've landed, is at 12 sessions weekly. And we've also heard about the length of the sessions and the group size, which varies. So I said we started conducting this in person and then had to shift to virtual data collection and shift in terms of people's thinking about a virtual delivery of an intervention. We actually explored both because we don't know what it'll look like as we come out of the pandemic. And so the group size was identified as smaller, and the length of the sessions were shorter for a virtual delivery compared to if it were in person. And the time of day was also a consideration. So through the co-design process, to date, we've had 10 meetings. We have 9 citizen partners and 19 organizational partners. And as I said, we've identified a number of features of the mode of delivery. We've had quite a lot of conversations about health equity and how do we address health equity related to this intervention. We talked quite a bit, as you can imagine, about the impacts of COVID-19. Would people want to engage? What would that look like? What's the timing to engage? Were people ready? Heard from our guiding council how people really, how we need to move forward as quickly as we can, as is feasible, because people are really missing those connections. And we know that there have been a lot of impacts for older adults in terms of social isolation. The qualitative study we've now completed. We interviewed 18 older adults and 16 providers, and we've been analyzing those data concurrently. And as we sort of had signposts, or what we were taking as sort of pretty consistent direction around particular intervention features, then we would bring that to the guiding council and say, okay, we're hearing some consistency around this. What are your thoughts on this? Can we make a decision on this? And then some, we're certainly continuing to analyze, and we'll be wrapping that up in the next few weeks. In terms of knowledge exchange, we had our launch event. I shared some of the KT tools that we've used, the knowledge translation tools. We've also had our guiding council for the organizational partners share overviews. I think that this was actually really helpful and valuable because we learned about some of the different supports that are available, and also about how programs or services had adapted to the COVID context, and to learn from some of their insights about adjusting their service delivery models. We've had newsletters that we've shared with the team, and we have an ongoing capacity building strategy in terms of engaging a number of learners, so from undergraduate to graduate to postdoctoral levels throughout the project. Next slide, please. So some of those impacts and adaptations. So some of the things we grappled with related to the impacts of COVID were digital inequity, thinking about equity and the health impacts, thinking about seniors who were socially and physically impacted, shifting our focus and resources. So we needed to do some shifts in terms of the funding that we had and look at how we needed to reallocate resources. In some cases, we were reallocating to support those additional reviews. Other things needed to be suspended for a period of time. In our co-design study, we expanded the scope of those reviews. We shifted to virtual recruitment and data collection, which was challenging. If any of you are recruiting, not the data collection so much, but the recruitment was incredibly challenging. Really hats off to Caroline Moore, who's our research coordinator, who made huge efforts to get our final recruitment completed. We reinitiated our guiding council meetings virtually. Most people were willing to continue or to shift to virtual, although we did have one individual who just wasn't comfortable doing so, and that's okay. But I do, it is a challenge. It's been something we grappled with around, are we going to end up excluding some valuable voices by shifting that way? We moved to, in terms of our plan for the trial, we moved to a hybrid approach to data collection. So thinking about different ways, whether people will, can do data collection by phone or whether they do it by a platform like this. We've updated our environmental scan because things have changed related to COVID. And we changed what some of our outcomes are related to the trial and the way that we'll deliver the intervention. So some of the ways that we responded to the COVID-19 context, we knew that even when we had a bit of a pause, we wanted to keep our very engaged partners in the loop about what was happening. We had ongoing communication with our partners and with the academic team. As we said, we restarted virtually. We engaged the Strategic Guiding Council virtually to co-design the path forward for the intervention features. And we delayed the start of our trial. That was an important and necessary impact. The opportunity, I think, has been because we were sort of on pause related to the trial and we weren't able to proceed. And I should say one of the important considerations there is that one of our partners, our planned partners in the intervention delivery, is public health. And we know that public health is extremely busy with very important work at this point in time. And so it wasn't the right time to be able to move forward with, looking for public health partners to deliver an intervention. And so we still have to reconnect with public health in terms of seeing readiness and availability to move forward on that front. As you can imagine, it's a bit of a moving target. So that's enough for me from now. I'm going to turn it over to Maggie and Penelope. I'm looking forward, as always, to hear Penelope's insights, because I always learn something different every time we have a chance to connect. So I'll stop now.
Thanks, Rebecca. So how we're going to do this is we have some questions so that everyone online can hear a little bit about Penelope's experience working with Emboldened. So yeah, first, Penelope, hi, morning, welcome. Why don't you tell us a little bit about how you got started being involved with Emboldened?
Well, I had been involved in a previous study with Rebecca. And so I was actually sent, I think, a version of the grant application for Emboldened to review, and because of that, I said yes, I'd be interested, and so I've been pretty much from the beginning involved with that. But it was yeah, I'm really glad too that I was asked to take part.
And that's great. Can you tell us a little bit about what type of research partner do you see yourself as in this kind of co-design space? We hear lots of people having different kind of labels. Some people it's patient, consumer. Tell us which one you identify with and why.
Well, yes, I think the government tends to refer to us as patient partners. I see myself more as a community partner, citizen. I'm an older adult. I have lived experience and hopefully can bring some insight from my perspective to it. But I don't see myself primarily as a patient partner.
Well,
So,
and I think that's so important because you're right, patient does seem to kind of dominate the language, but
well, to me, it sort of implies that you're sick,
totally.
you know.
And so tell us a little bit about the activities and projects and kind of like the day-to-day of your involvement with Embolden. Not that you're involved every single day, but I feel like some weeks we're definitely
No,
calling on you.
I've been absolutely fascinated with it. As I say, I read an early version of the grant application. I went to the first meeting, the one where the picture was shown of all the people in a room together, and I really missed that. But I've done, I've read bits of paper. I've been involved with. I've gone to all of the meetings, both in person and virtual. I really like the way this is being done. We're often divided into small groups, and there's a variety of people in each group. I've met some really interesting people. I've learned a lot about what services are available in Hamilton, that which from my perspective, because I'm involved in other groups, I've been able to pass on information to other groups in the city about a service that might be of value to their members. So I recently read a questionnaire that they're planning on that's going to be used for participants, and commented on that. Yeah, just a variety of things, whatever I'm asked.
And do you find anything, what, if anything, have you found challenging about being a research partner, either on Embolden or in other projects? Or
Nothing, well, for me, nothing really. The most challenging thing right now is the virtual. You get tired of sitting in front of a screen, but the conversations that we're generating sort of keep you focused and at it. But no, I find it probably because I feel that, there are a bunch of older adults within this group, and I feel that we're being listened to, and our opinions are valued, and we see them reflected. So we have a meeting and people have talked about something, and next meeting they'll show us an infographic or something that they've put together, and comments that I know that were made by some of the older adults will be there. So I think that's really important, that you actually see that your contribution is doing something.
definitely. Well, and it kind of brings us to the next question there, is just, what keeps you involved in Embolden, and when do you feel the most engaged in Embolden?
Yeah, well, the same sort of thing. The fact that I'm especially the Emboldened group there, everybody is so enthusiastic about this study. And, so we have, the researchers who are obviously very much engaged, but the service agency people are, you can tell they're really behind this study and feel very much that this is going to turn out to be something really good and valuable for the city. And that's got to help keep you engaged. I mean, when we have our virtual meetings, almost everybody shows up to every meeting, which I think is fantastic.
Yeah, we have to have all those breakout groups because we would never hear from 30 people.
Right. Yes.
Well, and I feel like you spoke a little bit about this, but when we had to go online due to COVID restrictions, what went well when we moved online and what was challenging? I'm sure that's kind of a curveball to what you thought you were getting when you signed up to be a part of the Strategic Guiding Council.
Yeah. Well, I guess, the challenging part is, well, for me, my computer can be temperamental. And so I have to get on the computer well in advance of a meeting just to make sure that it's going to let me in. But and sitting, especially on a day when there are days when I have more than one meeting. But I think the thing that has gone really, really well with the virtual is the breakout groups, because there's no background noise. You're in a small group, whereas when we have breakup groups when we're in person, but the room can get kind of noisy sometimes. So
Yeah,
that's been the best part of the virtual.
Yeah, I totally agree with you. The quiet makes it easier to think.
Yes.
And so in case we have, anybody that is thinking about involving older adults or citizen partners in the research, or any citizen partners that might be online, what advice do you have for those people that are kind of thinking about putting their toe in the water of this kind of research?
Well, I would say I'd go for it. I mean, you can become as involved or not involved as you want. And so it's not like you're committing your life to doing this. And it's really interesting. It's really stimulating, keeps the mind going. And yeah, I just like, and it's a great opportunity to interact with younger people who are still in the workforce, and young researchers who are so enthusiastic.
Yeah, I agree. I even find that too, that some of the other trainees are so impressive on this project.
Yes.
It's fantastic.
Yes.
So yeah, Penelope, do you want to add anything else? Any questions that I didn't cover there?
No, I don't think so. Basically, this particular study has been really fantastic. I mean, I've enjoyed all of the studies that I've been involved with, but this one I think is absolutely fantastic. I feel like the whole city has come together on this.
That's awesome. Well, and for anybody that might, if you do have specific questions for Penelope, I'm looking forward to telling you a little bit about the evaluation, but I'll try to make sure that we have some time to come back if you have specific questions for any of us. But thank you, Penelope. It's always great to hear, the nitty gritty of what it looks like. So yeah, hi everyone, my name's Maggie. I'm a postdoc and I'm working to evaluate the co-design piece of the Emboldened project. And Rebecca talked a little bit about the background of the Strategic Guiding Council, and just that idea that it's designed to have older adults and the community service providers engage in co-designing, testing, and planning for the use of the Emboldened intervention. And so in that sense, having their help to design the evaluation made pretty good sense. But there's some other good reasons for doing this project. I think if you folks are here, you kind of understand that it's become an imperative to involve patients in health research in Canada and elsewhere. And we know that generates more relevant and credible research. And it's also a democratic way to use public funds, to use taxpayer money. But we do know a little bit less about the impact of those engaged approaches. And what we've seen in other, Rebecca and I are working on a review of this. We've seen that people reporting often on, as a researcher, their own perception of how the engagement went. So kind of anecdotal evidence, and different people have said that sometimes the evaluation of the impact of engagement is kind of like an afterthought of studies. So you don't always see studies that have that as their primary aim. And we've also seen that it can be less common for engagement to be kind of participatory in nature, or using tools that have been developed in partnership with patients. And so kind of the bottom line is that it makes sense for us to have rigorous approaches to allocating public funds, and just ensuring that we understand what the impact of engaged approaches are. And so the aim of this study is to explore how research partners perceive Emboldened's engagement strategies, the engagement context, what's working well and what could be improved. And the kind of the results of this inform twofold inside Emboldened. As Rebecca mentioned, as the intervention rolls out into the community, we plan to have these community advisory boards in the different neighborhoods. So our evaluation of our engagement of the co-design will help inform how those community advisory boards run. But also outside of Emboldened, there's lots to learn about co-design and evaluating the impact of that in partnership with some of the people who are helping you co-design. So with this study, kind of the methodological approach is we just decided on using developmental evaluation, and that really helped account for some of the complexity involved in the co-design process. It's going on over 1 to 2 years, and like Rebecca said, there's kind of lots of elements, monthly meetings, different kind of places for people to comment and offer their feedback on materials. And also within developmental evaluation, basically the people become these social innovators, they're called, and they work together with the person who's evaluating. And that kind of becomes all meshed together into the intervention. And also, like I said, the special focus on the context that the co-design is happening in. And finally, and importantly for this project, is just within developmental evaluation, there is a focus on this rapid use or rapid integration of findings, which really folds nicely into how Emboldened is running things. So like I said, it can help us refine our approach to engagement with the Strategic Guiding Council, but also with those community advisory boards as the intervention rolls out into the different neighborhoods. And so I got a chance to work with some people from the Strategic Guiding Council, and we had a session where kind of I was learning a lot about co-design as well. So in kind of the Emboldened template, I was able to share a 1-page summary of kind of the aims of the project, some key questions with the people who agreed to participate. And then we spoke about it together in a session to learn what were the key priorities for evaluation and kind of how do we get there? How do we capture those key elements? So some of the things that were mentioned, so 4 people from the Guiding Council participated. And some of the key priorities among that group were they wanted to make sure that the evaluation captured the diversity of the Strategic Guiding Council. So just comments about the gender diversity of the group, that there's cultural diversity within the group on the Guiding Council, and like Rebecca showed, just that organizational diversity of having lots of different players in Hamilton coming together on this. A couple of other kind of like values that inform the evaluation, just that idea of satisfaction, fun, respect are some things that are going to inform the evaluation. And as Rebecca spoke about earlier, really just defining that impact. And so kind of tracing back through the monthly meetings over the past 15 or so months, all those little decision points. So we had a meeting here and this is what we talked about, and this is how your input helped us shape the intervention. And I think it came out pretty strongly in that session that tracing and that understanding all those decision points and those kind of opportunities for influence at every kind of twist and turn of the intervention was really important to capture in the evaluation. And in terms of how we get there, the group identified focus groups and questionnaire data as some good ways to gather that data. And also, I think thinking about like satisfaction, and there was some discussion of if people have negative comments, maybe a focus group isn't the best way to share that. So just having some both anonymous and in-person ways to offer feedback about the co-design in Emboldened. And here I just listed the 2 tools that we're going to be adapting in order to do this evaluation. And I hope to have members of the Strategic Guiding Council, help and work together with me to refine these tools. And as I mentioned, we do, in order to help us with the tracing of impact at different kind of decision points, we will be looking at the analysis of the meeting notes, and also the focus group transcripts will help us identify all those kind of like micro impact as the intervention has gone on, and not micro because they're small, but just because they're individual decisions. So some of the potential contributions of this study, just that this whole study and kind of my postdoc was designed to be the primary aim of my postdoc is to evaluate the engagement in Emboldened. And also, I think it aligns with the terms of reference that were set out by Rebecca and the Strategic Guiding Council at the outset to have the Guiding Council give input at every different stage. So it really made sense to have their input to the evaluation. Different folks in the literature have even talked about diverse older people's voices not being as present in the engagement literature. So this is a chance to kind of showcase, you know, the diversity that I spoke about, and that was also something that was important to the group. It's also important to note that we're going to be using tools that were designed in collaboration with patients as opposed to just designed by researchers. And additionally, one of the ways that we will be adapting the tools is just understanding benefits to and challenges to co-designing virtually. Different work that I've done, I feel like that's going to be a paragraph in maybe every paper that comes out in terms of COVID-19 and its impact on research. But I think there's important benefits here too when we look at patients or citizen partners. Some of what we heard is that maybe it's more convenient to be engaged virtually. And I know in some work that I'm doing on other projects, specifically for people who maybe are commuting or parking or have mobility challenges, maybe there are benefits as well as challenges. We know the long Zoom days can get to all of us. But I'm conscious of the time here, so I'm gonna stop here and open up to see if open up the chat and see if there's any questions. I think I see some blinking.
Yes, we don't have a lot of time because I know we're going to try to finish at 12:30. I know Mike has posted a question, so I'll have you maybe go first, Mike.
Or maybe I can, do you want me to just speak to your question, Mike?
Yeah, that would be great. I'm just wondering, in a bigger sense, you know, has having involvement of co-design participants shifted the project in any major way, and how did you deal with that?
So what I would say is, even from the outset, I think some of the things, and you know, each of us has sort of brought up how equity has really ended up at, you know, a major emphasis. It always was, but thinking about it in a fulsome way and thinking about, so for example, expanding our guiding council. So our guiding council has grown because with feedback from the guiding council to say, we need some other perspectives at this table. So we've expanded the guiding council to make sure that that it's more reflective of sort of the diverse populations in Hamilton. Thinking about a balance of who's at the table. I think processes, like our internal research processes, have changed. I also think some of the intervention features, it's, you know, it's not that the components have changed, but how they're delivered have changed. Specifically thinking about some of the outcomes, you know, Penelope talked about being involved in reviewing the data collection tools. So as a result of that input, we now have done a priority setting exercise to have our partners help us to identify what are the most important outcomes that we capture, because we know that we need to streamline our data collection tools. So those are some specific examples. I could probably go on about that, but I'd like to see if there are other questions, if that's okay. Happy to chat with you more about that if you'd like to. And I don't know, Maggie or Penelope, if you want to add to my response there.
I would just say, I think the one big shift that sticks out to me is just us grappling with that kind of like hybrid delivery versus in-person delivery. And just that we had really strong feedback from the guiding council that you need to do the intervention as soon as possible. And if that means that you start with kind of a virtual delivery due to COVID restrictions and you kind of move to more in-person as it becomes available, kind of people are struggling and they need this intervention soon. So I think that was maybe that was definitely something different than we envisioned.
Yeah, that was a big decision. As we were hearing from the persona scenario exercises, some of those individuals were saying, oh no, we'll wait till it can be in person because I think it's really valuable in person. And so we were that was one of those signposts. And we thought, okay, so we talked about it, in our sort of internal research team meeting. And as we were planning for the guiding council meeting, brought it to the guiding council and they said, you need to go back and think about this more. We're not, we can't just wait until it can be in person. We need to think about how we can move forward sooner rather than later.
I have a quick comment and a bit of a question. So, one of the things, the more I read about co-design, the relationships and the trust is so fundamental and central to the process. And it is clear, I get this sense of the energy and the excitement and the relationships that have been built. And I don't know if you can comment on, did that happen right away? Or has this taken some time to do that relationship development?
The relationships have really grown over time. I have felt throughout the project that whenever we talked about the intention of the project and what we were setting out to do, there was a lot of energy and excitement in terms of what, of meeting needs. So I think, people seem to recognize that there were unmet needs in the city of Hamilton, that this was a priority. And so there's always been that sort of commitment to the broader ideas. I think that some of it has been intentionally always building in the discussion spaces. So in terms of, we always have questions that we're asking for, we're trying to think, okay, as we're setting a meeting, are we trying to make the most of that time to get input from partners around key decisions? Are we, sometimes, and there have been other times where, for example, within our research team, people have variable experiences in terms of co-design. And so in some cases, they would say, well, can we just move forward with this decision? And we'd say, let's bring it to the guiding council. Let's talk to them, see what they think about this. So being able to, both speed up in some cases and slow down in other cases to make sure that we were really hearing what we needed to.
Thank you so much. I'm going to pop on behalf of the McMaster Co-Design Hub to thank you, Penelope, Maggie, and Rebecca, for sharing your vast experience on this topic. It's such a complex project, so to hear it from all your perspectives was so wonderful. I know people are going to need to hop off, so Emma, there are a couple of ways to stay connected to the Hub if you would like to attend additional sessions or access our resources. And there will also be a survey if people are willing to share some feedback on the session with us. It's in the chat. It will also come to you by Eventbrite. So whichever way you're more comfortable doing that, we would be grateful to have your insights and feedback so that we can continue to develop these sessions. But honestly, I can't think of anything else except perhaps more time that I would have loved from today's presentation. Penelope in particular, thank you for joining to hear. We often hear the researcher side of things and not as often the community side of things. So for me personally, to hear about your own gains, the things that you enjoyed, the things that you learned from and grew from and can contribute to was so valuable. I'm seeing some real life claps and some virtual claps. So everybody very much appreciates you being here and sharing. Thank you so much.
Thank you very much. It's always our pleasure to come talk about Emboldened. I tell you, it's a true joy. So thanks for having us here. And I too would like to thank Penelope and Maggie for this great partnership. So
thank you for asking me, Rebecca. I enjoyed it too. And I learned stuff too.
Me too.
Great. We're always learning together.
Yes, yes.
Our hub has also just gone through a developmental evaluation process. So if you'd ever like to connect about those methods and outcomes, we'd be happy to continue having this conversation.
Terrific.
That's
Thank
great.
you.
Thank you.
Okay.
Sounds good.
Take care, everybody.
Bye,
Nice to
everyone.
see you all.
Thanks.